Hi, my name is Andrea Ferris. I'm the President and CEO of Longevity Foundation. Welcome to our panel discussion today in partnership with Genentech about the vital role that comprehensive biomarker testing plays in the lung cancer treatment paradigm. We've invited several panelists to provide their unique perspectives, and I'm excited to introduce them to you. Sarah Christ is a lung cancer patient and advocate based in New York. Dr. Ray Osir-Guillaban joins us from the Baptist Cancer Center in Memphis, Tennessee, where he's a practicing oncologist. And Dr. David Rabin, who helps drive Genentech's oncology work as the Vice President of Development. I would now like to ask each of our panelists to introduce themselves and say a few words about how they've been impacted by lung cancer. Welcome, Ray. Could you tell us a little bit about yourself and your practice?
Yes, Andrea, thank you for the opportunity. Hello, everyone. My name is Ray Osir-Guillaban. I'm a thoracic medical oncologist at the Baptist Cancer Center in Memphis, Tennessee, which is a large community-based healthcare system. I'm also a health services researcher, and I am the chief scientist for the Baptist Memorial Healthcare Corporation.
So David, could you tell us a little bit about yourself?
Yeah, so my name is David Rabin, and I am currently the Vice President and Franchise Lead for the LASER team, which includes lung cancer, skin cancers, head and neck cancer, tumor-agnostic cancers, and rare cancers in our compendium.
Sarah, in your own words, could you tell us a little bit about yourself, about your experience with lung cancer, how you were diagnosed, when you were diagnosed?
Absolutely. Thank you, Andrea. I appreciate the opportunity to share a little bit of my story in the hopes that maybe it would help someone else. In 2016, I was a 50-year-old healthy, active, non-smoking mother of 3, and I began having some mild respiratory symptoms, a little shortness of breath and coughing. I had been working outdoors as a landscaper at the time and just chalked it up to probably some seasonal allergies. The symptoms sort of progressed throughout the fall, however, and eventually I ended up with some really severe pains in my upper back. That's what drove me to go to the doctor, but I never thought it could possibly be anything serious. I had done all the Googling and thought I had maybe some walking pneumonia. So I went to my primary care doctor. I saw his physician's assistant, who very fortuitously sent me immediately for a chest x-ray. The results of that chest x-ray were concerning enough that they sent me also fairly immediately for a CAT scan of my chest, which confirmed that there was a mass in my upper left lung that was, quote, highly suspicious for malignancy. I then had a sort of abrupt worsening of symptoms, which led to a 4-day hospitalization, during which I was scanned and poked and prodded and biopsied. And at the end of those 4 days, I left the hospital with a pretty certain diagnosis of primary lung cancer with metastases to the brain and liver. We were only waiting for the results of that biopsy to confirm what we already pretty much knew.
Wow. And did your doctor ever talk to you, Sarah, about biomarker testing, or what was your experience with that, and how did that come about?
Well, the doctors in the hospital and I were not discussing that. I left with an appointment, a follow-up appointment set up with an oncologist for the next week. And in the time between, we had spent a considerable amount of time researching things and making sure we were going into that appointment well prepared. A key member of my team is the woman who's now my wife, and she had a father who was a lung cancer patient and had been treated with targeted therapy for a targetable mutation. So we were aware that this was something that existed, but really didn't know a tremendous amount about it. We had also sought out some information and advice from a colleague of hers, a local oncologist, and one of the things he really stressed to us was you need to make sure your tumor is being sent out for testing, because this could really impact the course of your treatment.
Wow. Ray, could you, for the audience, just explain a little bit about what a biomarker is, why they're important, and how they're used in the treatment of a lung cancer patient?
Biomarkers in lung cancer are an exciting, rapidly emerging development that has really transformed both the care we deliver and the outcomes of that care. So for lung cancer now, there are about 10 different biomarkers for which we actually have FDA-approved actionable treatment selections that we could make. So comprehensive biomarker testing becomes vitally important because if you add these 10 different types of lung cancer up, they will represent about 75%. 3 out of 4 non-small cell lung cancers will be in this fold. And the problem is if you don't test for them, you will not know which one the patient would benefit from, which one of these treatments is likely to be super effective for the patient. Therefore, one of the big changes that we're needing to make sure everybody's aware of is the value of comprehensive biomarker testing.
Right. And then just as a follow-up, Ray, when you say it tells you what type of lung cancer, would you say that the biomarker testing can help a doctor understand what's driving your particular type of cancer so that they know how to treat it then? Because oftentimes people will hear driver mutation. And so is that what the comprehensive biomarker testing looks for or does?
Yes, the comprehensive biomarker testing includes genetic tests on the cancer, but also includes some protein tests on the lung cancer.
And when you're saying genetic, you don't mean inherited. You mean it's just the genomic change that's it's a change that's happening in somebody's genes, not necessarily that it is inherited.
Yes.
Correct?
So these are not things that you pass from mom or dad to kid. These are not things that the lung cancer patient will pass to their family. These are acquired mutations, what we call somatic mutations. These are changes to the structure of DNA that happened in some renegade cells somewhere along the line after somebody was born that made those cells refused to die or made them continue to proliferate, what we call a cancer.
And so, David, you've seen both sides of the fence from lung cancer, both as a clinician and now in industry. Could you just talk a little bit about how the healthcare industry views comprehensive biomarker testing and Genentech's particular point of view on this?
Yeah, Andrea, our motto in the lung team and actually really across all our oncology groups is no cancer patient gets left behind. And this includes people with all forms of lung cancer, including rare types, and people with every stage of disease. No matter the type of stage or the type of cancer, biomarker testing clearly has the potential to provide a more precise treatment approach, as well as reduce costs and unnecessary treatments and spare added toxicities. So I think, for instance, Genentech and our partners are actively exploring the role that certain types of blood tests known as liquid biopsies could have in predicting a patient's chance of disease recurring, and how our medicines in combination with these blood tests really could help delay that return.
Yeah, that's a very good point, especially about the not having additional toxicities, so in things that are more effective for patients. Sarah, what advice would you give to somebody newly diagnosed, both about their treatment, about seeking information, about comprehensive biomarker testing? Like, what would you say to somebody newly diagnosed of information they should know or where to get that information?
Well, my story had a little bit of a hiccup in it after that first appointment because what happened was the doctor told me that my situation was so serious that we really needed to start treatment right away without waiting for the results of that biomarker testing. So I was started on a pretty aggressive chemotherapy regimen a week or so after that appointment, and went through 4 cycles of chemo over the course of 2 months before that report surfaced that I had a targetable mutation. So that we had just assumed at the time, oh, well, these things take a really long time, so we'll just be patient and wait while I'm going through chemo. As it turned out, when I finally got a copy of the report, it was dated the day after I began my first cycle of chemo. So if we had waited that one more day and somebody had been on the ball to read the report in a timely manner, I probably would have started on targeted therapy instead of starting on chemo. So talking to newly diagnosed patients, it's one thing that I would stress is to not only ask for biomarker testing, but to press that it's done in a timely manner, that the results are back in a timely manner. And I would also ask them to, if at all possible, consider waiting to start treatment before you have those results in hand. I know now that they only take about 2 weeks. I mean, that was back in 2016, so maybe it's even faster, but I know there's not a 2-month turnaround time, and you can probably wait it out and get those results to really make the best choice of how you're going to go about your treatment.
That's great advice, but wow, what an incredible story. Ray, look, not everybody can come to see you or, people like you, experts in the field. So what questions should people ask their oncologist, or what questions should people be aware of when diagnosed with lung cancer, particularly if they're not at a large medical center with thoracic specialists?
What we need is to empower our patients with knowledge. And we need to encourage our patients to ask the tough questions.
Which ones would those be?
What do I have? Lung cancer? What type of lung cancer do I have? Is it a small cell or a non-small cell? Is it an adenocarcinoma or squamous cell cancer? These are all generic questions. What is the stage? Meaning, how widespread is my cancer? How much cancer have I got? But the key question here is, what is my biomarker profile? Do I have a biomarker that gets me into targeted therapy? We should insist to the doctor, because there's a lot of imperfect knowledge among oncologists about the value of biomarkers. So there is a huge disparity in access to biomarkers, depending on who you see and where you go seek care. And we need to completely do away with that. Patients need to get in the face of their healthcare providers and ask, have you tested me for biomarkers? If not, why not? And if the answer is anything but yes, I would suggest the patient seek a second opinion.
So David, do you expect that comprehensive biomarker testing will ever become standard of care and just become adopted as part of the practice of lung cancer?
I really want to emphasize that biomarkers unlock critical information that can determine if someone may benefit from a personalized medicine. And as our understanding of biomarkers improve, along with the technologies and techniques, I really expect testing rates, to your point, to go up. And I think we're going to see increased lung cancer survivorship. I mean, we're seeing that dramatically over the last 4 or 5 years now. And I think it's going to continue to increase. And I think acceptance by payers, when they see the benefits of a more precise pathway for each lung cancer patient evolves, they're going to come around as well. So I truly believe it's going to go up dramatically. And I think we're at an inflection point, in fact, in that area.
That's great. Thank you, David. Ray, I'd love to ask you, so what are you most hopeful about for lung cancer? And why should people diagnose today, they have more hope than they did 5 years ago, certainly 10 years ago, maybe even 2 years ago. But what do you think? What excites you about where we are in lung cancer? I mean, you've been at this for a long time.
Andrea, as you know, these are exciting times. We have now, we are now flipping the narrative about lung cancer from gloom and death to survivorship. Lung cancer, the story of lung cancer is increasingly a story of survivorship. Yes, it is disappointing, bitterly disappointing, to go from seeming health to, oh, you got lung cancer, it's a life-threatening illness. But once you get past that point, the fact is, if we deployed today the full body of knowledge that we know about diagnosis and treatment that works, that's already proven, we would see a significant increase in the proportion, the fraction of the patients with lung cancer who live for years and years and years. What we never heard of once before, what we never expected to see before. I'm still careful up front to tell my patients, yeah, this is a life-threatening illness. We don't have a cure when it is stage 4, but the treatments are highly effective. And what I advise my patients at bottom line is do everything you can to stay alive, because right around the corner is something that will probably transform your life expectancy overnight.
Sarah, what information would you provide to a newly diagnosed person? Obviously about biomarker testing, I think we've talked about that, but just in general, I mean, lung cancer diagnosis is a shock and it's stressful and it's scary. So how would you advise new patients to navigate that or find information or hope?
Well, absolutely. That's a key part of my success is to stay grounded in hope. I would tell anyone who's newly diagnosed to seek out those stories of hope, because that's the only way you're going to be able to tamp down the fear that inevitably comes with this diagnosis. It's a scary, uncertain time in anyone's life. And if you reach out and start looking for stories of hope in the lung cancer community, you will find many. I myself am living proof that there's life after a lung cancer diagnosis. In the 4 years since I was diagnosed, I have taken some fabulous trips with my wife and with my children, including one to Costa Rica, which was a lifelong dream of mine. I was able to watch my daughter graduate from high school and head off to college. We had a wedding. I've lived through a global pandemic. So, I've been able to experience the gamut in these 4 years. And for that, I'm super grateful. And I try to stay every day. Of course, there's always going to be dark days, but I try to start every day really grounded in hope for the future, not just for myself, but for all my fellow lung cancer patients and those who are going to come in the future.
Thank you, Sarah. That is a great way to close our discussion with your incredible message of hope. And I'd like to also thank all of our panelists for sharing your unique perspectives with us. I think we can see why comprehensive biomarker testing is so important, and we encourage all of you to go to the Longevity website to learn more about comprehensive biomarker testing. Thank you for spending your time with us. I hope you enjoyed the panel, and have a great day.